there is a cross reaction. Okay. This test was earlier done, but now is not done routinely. Nevertheless, this patient was diagnosed as a case of scrub typhus. He was given doxycycline and the patient recovered very well. Now, this is, I think, your first time hearing about scrub typhus, right? So, what is typhus? Any idea? You have read about typhoid fever. So, what is the difference between typhus and typhoid fever? What is typhus? So, basically, typhus means, from the Latin, it derives, it is a delirious state. Delirious means a person who is having delirium because of the high fever. Okay. So, this state of was called as typhus-like. Hence, all those fever which causes delirium were earlier called as typhus fever. Okay. In case of enteric fever, progressive enteric fever may also result in those type of symptoms, but they were not exactly caused by, or etiology was not typhus. Hence, it was called as typhoid. Okay. Now, let us go through. So, what are rickettsial infections? Scrub typhus is a rickettsial infection. Rickettsia are there. Remember three things. First is they are vector-borne pathogen. Okay, so they need a vector. Next, what is the main etiology? They cause what is known as acute febrile illness. And microbiologically speaking, what they are obligate intracellular parasites. Remember this thing, obligate intracellular. You have heard about obligate aerobe, obligate anaerobe. So an obligate aerobe cannot survive with a lack of oxygen, right? So this obligate intracellular means they cannot survive extracellularly. Okay. So now do tell me, if an organism cannot survive extracellular, can we culture in laboratory? On the various culture media that you have read? No. Okay. I'll come to the diagnostic dilemma later. And they are aerobic, small, gram-negative coccobacilli. Okay. So what are these things? They are aerobe, obligate intracellular, gram-negative coccobacilli. What is coccobacilli? They are bacilli, but the size is very small, almost like that of cocci. Hence, they are called as coccobacilli. All right. There are many rickettsial infections in human body. They have been classified into either spotted fever group, typhus group, ancestral, and transitional group. Today, we will be discussing about the more important diseases. Okay. The important diseases are Rocky Mountain spotted fever, African tick bite fever, Mediterranean spotted fever, and typhus syndrome. All right. First, I will give you the overall overview of all rickettsial infections. Then I will describe in very brief each and every infection which are important. Okay. There are many infections, but I'll only be highlighting the important ones. Okay. So, I have already said they are vector borne. So, what are the vectors? What is a vector? Vector means an organism which transmits from one host or environment to the other host. Okay. It could be a mechanical vector, it could be a what? Mechanical vector, can you give an example? Housefly. Okay. All enteric diseases. How do the housefly become a vector? They mechanically carry the pathogen from one place to the other. Or it could be a mosquito in which the organism goes through changes. Over here, the vectors include ticks, body lice, mites, and fleas. What are ticks? What are ticks? কুকুর বা বেড়ালের গায়ে ছোট ছোট কালো কালো দেখেছো স্ট্রিট ডগের গায়ে, those are called as ticks. Okay, I think Bangla এটুলি বলে, I'm not sure, but those are ticks. Fleas are mosquito like, but they feed on animals. And what are mites? There are various types of mites, dust mites, even bedbug and louse, they are also part of these vectors. Now please remember, humans are accidental hosts. So their normal life cycle, the human beings only comes by accident. There are many types of ticks like Dermacenter, Andersoni or variabilis, Amblyomma. If you can remember the names, very good. If you can't, don't worry. Now, coming to the pathophysiology, almost all rickettsial infection, the primary damage that is done is in the vascular endothelial cells. Vascular means blood vessels. It damages the endothelium of small and medium vessels. It leads to disseminated inflammation, loss of barrier function, and altered vascular permeability. When I say altered vascular permeability, what does it mean? That means vascular permeability is enhanced. Hence the symptoms, what will be the symptoms? Because of inflammation, there will be fever, myalgia, and CNS symptoms might be there. Because of endothelial inflammation, this may lead to meningitis or meningismus. This is the reason why this fever may cause a delirious state. Hence, typhus fever. Understood? Okay. So, what is the important thing that we will be looking for when we are suspecting rickettsial infections? These are very important because clinically you don't want to get into the classification. You want to diagnose the case, right? So, first look for whether there is any history of flea or tick bite. Now, next comes the question, where can a human being get a flea or tick bite? Obviously, not at home. That means outside. Where? Commonly, these ticks and fleas are found in forest, shrubs, grasslands. Okay. So, travel history is very important. Next, the patient will typically come with a triad of fever, headache, and rash. All right. So, if the patient comes with three things, remember fever, headache, and rash, always keep rickettsial disease in your suspicion. Next, other findings might be like lymphadenopathy and myalgia, arthalgia, hepatitis. It may also present like influenza. Not necessarily all the three symptoms might be present. Sometimes the tick or flea bite may be present, but the patient might not give a proper history or might not elicit the tick bite. Understood? In that scenario, the patient will present only with influenza-like symptoms. Hence, a detailed history of travel and outdoor exposure. I'll come to travel later on. First, in the case I have discussed, you have seen a rash and I called it as eschar. So, what is an eschar? An eschar is a lesion that occurs at the site of tick bite. It is basically an inflammatory reaction in response to the tick bite. Alright. And another important, because the organism is transmitted from the tick to the human being by this site, so the organism load will be the highest at this point. So what happens is, in a few days with a median time of 5 days, this will be the bite. See, you can see the bite and the inflammation around it. Can you see? And slowly, now this is because of vasculitis. I have already told you inflammation of the endothelium, small endothelium, vascular endothelium. So what will happen to vasculitis? Blood supply will be cut off and this area will slowly get blackened out. So initially it may look like an erythematous plaque. Erythematous means red colored. Plaque means an area that is red in color but not elevated. Alright. After that, it will develop a central ulcer with brown to black crust with an annular red halo. What happens is the blood over here forms a crust, brown to black color, but the inflammation persists. When it heals, there will be a scar. Okay. So when you are taking history of a tick bite, look for these things. Okay. Now, a very important question is where to look. In a human body, where to look for these kinds of bite? It's a common question. Say you go into the on a safari in the forest. What is the probability of exposure? Commonly we see that the arms and legs are commonly affected. But look for some hidden areas. What are the hidden areas? Scalp, especially women with long hair. The tick might get into the hair and bite anywhere in the scalp. Behind the ears, behind the pinna. Okay. In the belly bottom, in the navel region. Okay. So these are hidden areas. Now, what would be the diagnostic test that you want to do? So you have learned about the history, you have learned about the clinical examination, what you have to do. Now you want to confirm the diagnosis. Will Felix is not done right now. What test can be done? Mainly is serological response by IgA and IgM. I think by now you have learned about IgM and IgG. IgM is the initial response, and on over a long period of time, IgG will come. Now, I have already told you it's an obligate intracellular organism and it is highly infectious. Hence, laboratory diagnostic test is very difficult to do. It requires a higher biosafety level. Can you recall the levels of biosafety? What are the levels of biosafety? Biosafety levels are 1, 2, 3 and 4. Right? So routine testing, what we do? We only for biosafety level 1. For biosafety level 2 and 3, we need separate laboratories. And biosafety level 4 is completely contained. Okay. So what other thing we can do? I have already told you the tick bite forms an eschar. That is where the load is maximum. So we can do PCR. PCR is amplification of the nucleic acid of the organism. So molecular diagnosis can be done. Alright. So these are the only two modalities. Other modalities could be associated laboratory markers. What are associated laboratory markers? We can find thrombocytopenia, hyponatremia, anemia, and cerebrospinal fluid pleocyte. What is pleocytosis? Raised WBC count in CSF. All these because of capillary leakage. Okay. Now, always remember the serological test or the serological response comes after the infection gets over. Right? So, if the patient is acutely ill, you may not get a serological response. And obviously, molecular tests are not available everywhere. If it is available, very good. If it is not, then remember these two lines. High index of suspicion should always be there, and a negative test of any of these tests should not preclude treatment. That means you have to give the treatment. Understood? Don't wait for the test results to come. You have a very limited set of tests and they are not totally reliable. So, you can see in this diagram. So, this is the eschar. It is first cleaned with isopropyl alcohol and then the de-roofing is done. What is de-roofing? The crust that forms, you have to remove the crust. And then the swab stick, sterile swab stick is inserted on the side of the bite and it is rolled over there. I have already told you about serological response. A fourfold change is diagnostic. Hence, you have to take two serum sample, acute and convalescent. What is convalescent? What is convalescent serum? Okay, this is the process of taking the sample. First rub with alcohol, then de-roof, then take the sample and send in a sterile container. Okay. Coming to the treatment. Almost for all rickettsial infection, the drug of choice is doxycycline. Antibiotics have been taught to you all? No. Okay. Doxycycline is a group of, among the tetracycline group of drugs, it is almost effective in all rickettsial infections. But please remember, because of the adverse effect, the doxycycline should be given very carefully in children and should be avoided if possible in case of pregnant women. Okay. But if no contraindications are there, doxycycline is a drug of choice. And in case of pregnancy or tetracycline allergy, an infectious disease specialist and then give. Okay. So duration of treatment is 5 to 7 days. Dose is generally 100 milligram twice daily for 5 to 7 days. And more importantly, when you will go into the clinical ward, if you see a case of rickettsial infection, you will see a very good response after giving doxycycline. Within 48 hours, there will be defervescence of fever. Okay. Remember, the treatment should not be delayed at any case. Chloramphenicol is an alternative option. Just remember these two drugs, doxycycline and chloramphenicol. Now, acute febrile illness, you will have many differential diagnoses. What are the different common differential diagnoses are? Dengue, malaria, streptococcal infection, leptospirosis, measles, meningococcal, rubella, syphilis. All these things are common cause of acute febrile illness related to infectious cause. Okay, I have already told you the rickettsial infections are divided into predominantly two groups, spotted fever group and typhus fever. So by spotted fever, what do you mean by? It's an acute febrile illness with rash. Spots means rash. Okay. And typhus means acute febrile illness with CNS symptoms like headache. Now, among the spotted fever group, the important are Rocky Mountain fever, African tick bite fever, and Mediterranean fever. Among the typhus fever group, important are epidemic, murine, and scrub typhus. There are two other organisms. If you want, you can go and read, but at least get familiar with two other organisms I will discuss in the end. Now, why these are important? I have already told you, because of the international travel. Today, human beings are traveling from one continent to other more frequently than ever. Okay. For example, Rocky Mountain spotted fever. This disease is not seen in India. However, it is seen in United States, right? So you can easily have a relative or your parents moving to United States, coming back after 2 to 3 weeks, and on returning, he or she might have an acute febrile illness. Similarly, if you look in a map of United States, these are the areas of where Rocky Mountain fever is seen. Rickettsial diseases see all over in Europe. Now, if we look in Asia, these are the areas, including India. This is known as Susugamushi Triangle. I will explain it later. North Africa, Sub-Saharan Africa. The point I am trying to make is, you go to America, you go to Europe, you go to Africa, you go to Asia. Rickettsial disease is present all over the world. Okay. So please get aware with these diseases. Now, spotted fever groups, I've told you, one is known as Rocky Mountain spotted fever caused by Rickettsial. The Mediterranean spotted fever caused by Rickettsial coronae. African tick fever caused by Rickettsial africa. And Rickettsial pox is caused by Rickettsial academy. These are the predominantly 4 type of diseases. And you can see all are transmitted by these vectors. These are ticks. Okay. Somewhere it may be hard tick, somewhere it may be soft tick. At least remember it is transmitted by ticks. Okay. Various species are there. And this transmission is from rodents, mammals and reptiles. বলো কিছু বলছিলে বলো So coming to Rocky Mountain spotted fever, it was first seen in the Bitterroot Valley in Montana. Hence it was named as Rocky Mountain spotted fever. The causative agent is Rickettsial and the vector is known as Dermacentor. Over here, remember one thing, that transmission is by the ticks during feeding, and also the hemolymph of the tick is also infectious. So if you pick the ticks with your bare hand and crush it, you may still get infected. Understood? So do not use your plain hands. Okay? Now what is the manifestation? Incubation ranges from 2 to 14 days. It commonly associated with fever and rash. These are the rash. You can see small spotted rash which evolves over time along with severe headache, myalgia, vomiting, abdominal pain and meningeal symptoms. Other involvement like any organ may be involved. It could be myocarditis, it could be hepatitis, thrombocytopenia, and Rocky Mountain spotted fever had a very high case fatality earlier before the invent of the antimicrobial therapy. But now the case fatality rate is microbial therapy, the case fatality rate has come down. But please remember, only on use of antimicrobial therapy the case fatality and the effervescence of fever is seen. Okay. So proper therapy is always required. Diagnostic is skin biopsy and PCR. Treatment is, I have already told you, doxycycline. Now coming to Mediterranean spotted fever, it is seen in the Mediterranean region, and just I want to highlight this one. It is caused by Rickettsial coronae. There are many subspecies. Among them, the indica subspecies cause Indian tick typhus. This is seen in India and Pakistan. Just a variant of Mediterranean spotted fever. These are the geographical area, and this is the tick that transmitted, rhinocephalus. Obviously, the presentation is same: headache, chills, and myalgia. Scars may be seen, and problem with Mediterranean spotted fever is if there are other comorbidities like diabetes, alcoholism, liver dysfunction, morbidity and mortality is much higher. African tick bite fever is seen in the, obviously, as the name suggests, in the African region, both the northern and the sub-Saharan African. But it is also seen in the Caribbean islands. It is transmitted by the ambyloma. This is the vector. However, tick bite fever is much subdued in its presentation. Mostly presents as self-limiting disease. The symptoms are same: fever, eschar, headache, rash and myalgia. Now, these are the spotted fever. Okay. So, spotted fever are Rocky Mountain spotted fever, Mediterranean spotted fever, then African tick bite fever. Among the typhus group, there are three types. First is scrub typhus, second is epidemic, and third is murine. The murine typhus is also known as endemic typhus. Now, first we'll discuss about scrub typhus. Why? Because India, because of the geographical position, comes under the Shushugamushi triangle. Before that, the bacteria which causes is called as Orientia Shushugamushi. This is the name of the Rickettsial. It was initially first, this organism was identified in Japan. You know, the Southeast Asia was initially called as Oriental. So, Orientia and Shushugamushi named after the person who found it. The 1999 WHO reported that scrub typhus is the most underreported disease in the world. Why? Because the manifestations are similar and it responds very well with doxycycline. So hence reporting is generally not done. Now, if we can appreciate this triangle, India over here, Australia and up to Japan, this total area is known as Shushugamushi triangle. Why? Because the vector over here, chiggers, they are found in this geographical region. However, please remember, nowadays it is also found in Chile, Dubai, Cameroon, Kenya, and even other countries. Obviously, the main responsible factor is international travel. Now, it is transmitted by chiggers. If you can see, this is a very small lesion. This is a chigger bite lesion. If we look carefully, it almost resembles like that of malaria. Malaria bojo? Pati bangla ঘামাচি বলে। ঠিক আছে? So if you don't observe carefully, you are likely to miss the chigger bite. Now, where are those found? They are found in these regions: grassy regions, shrubs, grasses. This is the transmission. These are the chiggers. They live over there, and when the human being come in contact, they bite and present with eschar at the bite site, fever, rash, and pneumonia. So early manifestations will be skin manifestations, regional lymph node, later on fever, headache, generalized lymphadenopathy, and other symptoms, including gastrointestinal symptoms. Sometimes scrub typhus may present with very severe manifestations. The severe manifestations are acute respiratory distress, pneumonitis, meningoencephalitis, GI bleeding, acute renal failure, shock, coagulopathy, and sometimes myocarditis and pericarditis. These are the severe manifestations. It is seen where the antibiotic treatment is not given. The next part is epidemic or louse-borne typhus. If you read about the many European war history, you have heard about Napoleon Bonaparte. Many a times he lost a war because of epidemics. Those epidemics were caused by these louse-borne typhus. Now, when I say louse-borne, the vector will be body louse. So, it is caused by Rickettsial provazacai, and by body louse, what is its name? It is called as Pediculus humanus corporis. So, in which population fraction you commonly associate with body louse? Body louse is an infestation. So, in which kind of population you are expecting? Obviously, the deprived people of our society, okay, like homeless people, then people living in severe poverty, and sometimes in very poorly managed jails earlier. These are the where body louse infestations were seen. The infections are basically very latent and it resolves on its own. However, whenever the patient's immune status goes down, the infection flare up. Okay. So this is also known as relapsing fever. And this recrudescent typhus was earlier called as Brill-Jensen's disease. The characteristic incubation period is 8 to 16 days, manifest with fever, myalgia, intense headache. Rash begins by the 5th day at the site of the bite of the louse, and then slowly the rash spreads entire body except face, palm and sole. Treatment is overall same, doxycycline or tetracycline or chloramphenicol. However, if there is an outbreak of epidemic typhus, there may be an outbreak. In case of outbreak, single dose of doxycycline is sufficient to prevent the spread of the disease. Coming to murine typhus, murine means mice. Okay, so it is strong. So reservoir is ratus, and it is spread by rat flea. Rat flea is called as Xenopsella chiopsis. Similar manifestations with headache, fever, myalgia, nausea, macular or maculopapular rash is seen. Prolonged infection may cause CNS, hepatic or renal failure. Treatment is overall same. Alright, so these are the three main typhus fever: scrub typhus, epidemic typhus and murine typhus. Now coming to prevention, all are animal associated and vector disease. There are no vaccines against either the spotted fever group or typhus. So if there are no vaccines, the only recommended is antibiotic therapy only to the patient. There is no prophylactic antibiotic. Remember, when you will go and read in case of malaria and other diseases, prophylactic antibiotic can be given, but not over here. Antibiotics are given only if the patient is infected. So how to protect yourself? Obviously, you have to keep your body covered. When you go out, including these high boots, shoes, long sleeves, pants and hats to protect your head from being bitten. Whenever you go out, or if a person intends for any kind of outdoor activity which involves going out in these areas, after he or she goes out, important factor is he or she should take a shower after coming from outside. And look, what are the areas? Hair, ear, armpits, belly buttons, on the waist and in the back of the knees, the popliteal region, because these are the generally hidden areas. And if the tick is seen, you have to remove the tick. How to remove the tick? With the help of a tweezer. The tweezer should be held along the skin, firmly gripped and should be taken out. The tick should be killed with disinfectant like alcohol. It should not be crushed, remember. Because whenever you are crushing, you are exposing yourself. This is a list of the travel kit. This is generally recommended by the CDC when you go outside. And among them, you should have tweezers and these among the over-the-counter medications, you should have doxycycline. Okay. Now, important thing is the travel history, diagnostic test. You should be aware whether these sort of diagnostic tests are actually done in your vicinity or not. And if not done, where these tests can be done, you should be aware. And obviously the therapy. Now for the final part of the discussion, I will discuss only about two organisms. First is Q fever and then ehrlichiosis. Okay. Now as you can see, the name is Q fever. The name comes from Q. Q means query. Earlier, this case presented in certain form of acute febrile illness. No cause was identified. So the etiology was unknown. Hence, it was called as query fever or Q fever. Now we know the causative organism is a Coxiella burnetii, and it is a highly infectious agent. Okay. Like all other Rickettsial, it is an obligate intracellular organism. It causes acute infection which involves pulmonary and hepatic. It's a systemic illness but involves the lungs and the liver. So if it involves the lung, what will happen? It will present with pneumonia, cough, fever, and if it involves the liver, there will be raised liver enzymes with or without jaundice. Okay, when I say it is extremely infectious, remember one single organism is capable of infecting a human being. I think in general bacteriology you have learned about virulence, something called as infective dose. That is the minimum number of organisms required to infect a healthy individual. Over here, it is a single organism can infect. It is seen all over the world except New Zealand. Now, how does it enter? See, this is the normal cycle that goes on in the environment. These ticks bite the animals, including cattle, cats, and other farm animals, and the infection persists over there. The human beings come in contact with these animals and their excreta. Okay. From there, human beings inhale. This causes the infection. So, who are the people who are more commonly involved? Abattoir worker and veterinarians and animal farmers. Abattoir worker, what do you mean by abattoir worker? People who take out the skin of the animals in the leather industry. So it presents, so inhalation of the aerosolized particles causes the infection. It causes non-specific febrile illness, presents with pneumonia, hepatitis, and if severe, it can cause meningoencephalitis. These are the acute form. Sometimes or very rarely chronic infection is seen where endocarditis and granulomatous hepatitis is seen. What is granulomatous hepatitis? Pathology তো পড়ানো হয়ে যেত granulomatous inflammation পড়ানো হয়নি okay so this is a radiograph you can see non-specific changes seen rounded nodular bilaterally this is a typical presentation of a pneumonia in Q fever. The fever over here is very high, 40 to 41 degrees centigrade. That means very high fever. Incubation period of 4 to 5 days. Now, very important part is please remember this line. Q fever does not usually present with rash. Because I have already told you the mode of infection is inhalation of aerosolized particles. Generally, we see that Q fever resolves on its own, but sometimes it may become severe. The severity is more common in people with pre-existing diseases like valvular heart disease and prosthetic valve. In them, the disease becomes much more severe. Now, I have already told you the organism is highly infectious. Even a single organism can cause infection. So, culture is not recommended. It should not be done. Serological testing can be done. PCR is another method. But generally, problem with serological testing is until and unless you can demonstrate a fourfold rise in antibody titers between acute and convalescent sera, you cannot definitely diagnose. Okay. So for acute diagnosis, serological diagnosis is generally not very helpful. Treatment of choice, over here doxycycline is given, but remember the alternative are cotrimoxazole, chloramphenicol, rifampin and okay, at least remember doxycycline and cotrimoxazole. Okay. Final part, if you can read, go and read. Among them, there are three: Ehrlichia, anaplasma, and neoricketsia. So, what is the involvement here? Two diseases: human monocytic ehrlichiosis, human granulocytic anaplasmosis. Now, monocyte and granulocyte. What are monocytes? What is the difference between a monocyte and a granulocyte? Physiology question জিজ্ঞেস করছি first year. So both these generally present with a similar kind of manifestation with fever, systemic infection, and what happens over in case of Ehrlichia chafensis, they grow inside human monocytes. And in case of Ehrlichia ewingi and Anaplasma phagocyticum, they go inside the granulocytes. What are the granulocytes? Huh? Right. Okay. If possible, go and read in depth. So, this is just an overview of all the rickettsial infections. So, just to recap in 5 minutes, Rickettsial are gram-negative coccobacilli, which are obligate intracellular. That means they cannot go outside cell. All the infections are vector-borne. What are the vectors? Commonly they are ticks, fleas, or lice. Okay. Manifestation is seen with two main manifestations. One is known associated with predominantly rash, so they are called as spotted fever group. Okay. Other group involves fever with CNS symptoms, headache and meningitis. They are called as typhus group. Okay. So in spotted fever group, the important diseases are Rocky Mountain spotted fever, Mediterranean spotted fever, African tick bite fever. In typhus fever group, we have scrub typhus, epidemic, and murine typhus. And the other one, the Q fever, it is caused by Coxiella. It is not a part of the Rickettsial, but I have just told you. Coxiella is like Rickettsial, is an obligate intracellular organism, but it does not require a vector. It is mainly an accidental disease. It occurs due to inhalation of the pathogen. Okay. So this is an overview of all Rickettsial disease. Have you understood? Any questions? No? Okay.